Hello everybody, this is Dr. Haley again. Today I want to answer this age-old question. Do I need to see a chiropractor? We get that a lot. And the funniest thing is when you're at a party, somebody knows that you're a chiropractor. Oh, my back, oh, my aching back, oh, my neck, and you take a look at it. And they're kind of doing it in jest. Is that the only reason you need to see a chiropractor, because you have a bad back and neck? Well, sure, if you do have spinal problems, do have back problems, headaches, it's a great opportunity to see a chiropractor. But let me just explain a little bit about what a chiropractor does. This is our wheelhouse right here. This is what we deal with, the spine, the human spine. And what people don't realize is they see the spine and they don't see all the intricate little things about it. What sits up here is your brain. Basically you have nerves coming down, a nice spinal cord, and it comes out into the nerves and it goes all throughout your body. We have to see the spine is not only a bag of bones or a bunch of bones that are stacked up on top of each other, but a living, breathing nervous system. You also have muscles in there to get tight and tense. Everybody always knows about the muscles. They come in and say, look, I think I pulled the muscle. But they don't realize sometimes when the muscles get pulled out of alignment too much, they start affecting these joints, they start affecting the nervous system. They can pinch off these vital nerves. How does this happen? Well, you should maintain your spinal alignment, hopefully from when you're a young kid to when you're a little bit older and throughout your life. You always take care of your teeth and you maintain good dental care throughout your life. You maintain your car, try to keep it as long as you can. You got to try to keep your spine the best you can. The spine should have nice normal curves to it. Now this spine's a little bent out of shape because I'm twisting it and bending it, showing patients demonstrations all day. But basically you have nice normal flowing curves from the lateral side, which is looking this way, or from the frontal view looking this way here. So you should have nice and straight here, nice and curves in this area. What can actually knock your curvature out of alignment is just posture. Everyday stress. If I'm sitting at a computer all day, or if I have a history of playing sports, or I'm currently playing sports, or if I happen to be in an auto accident, that can do it really quickly. What it will do is actually get your spine off center. When that happens, what it does, it starts pulling on muscles irregularly and it throws them out of balance. Your muscles, just think of it as guide wires. When it's straight up, the muscles should be balanced side to side. When I move, I should have good movement in my muscles and they should all fire properly. If that doesn't happen because of an injury or because I'm out of alignment, I could have problems down the line. If it's in my low back, I could eventually have sciatica or I could blow a disc out. Okay? If it's up in my neck and shoulder area, I could have pain down my arms or a carpal tunnel type syndrome. But basically, it all stems from good alignment. So a chiropractor will look at your alignment. And you don't have to have pain to get your alignment checked. There's a lot of people, you could go today and look out in the streets and you can see people walking with their head so far forward or their shoulder high. They might not necessarily be in pain at this moment, but they might have some dysfunction down the line. So it's always a good idea to at least get your posture checked. Then from that, we want to see the range of motion. We want to see intersegmental motion. We're going to check each segment here and make sure it moves properly. Okay? Because if there's any kind of hitch in there or any kind of problem where it doesn't move in the way it's supposed to move, it could irritate these delicate nerves there. Now, if you look at this model, these nerves are kind of cut off a little bit because obviously we don't want nerves dragging on the floor. But these nerves, say in this area here up in the cervical spine, go right down into my hands, right down to my fingertips. And if I have some misalignments of the spine, what a chiropractor will call subluxation, because it could irritate your nerves, I could theoretically have some carpal tunnel syndrome. I could have some radicular pain, which is just radiating pain down into my arm here, or just pain down into the arm. And if it's in my low back, I could have that sciatic pain. We see a lot of patients with sciatic. So we want to have good alignment. We want to have good range of motion. Okay. We also want to evaluate your job stress, what kind of activities you do. If you're sitting at a computer 8 hours a day, well, I hate to tell you, you're putting a lot of stress on your spine. If you're doing a physical job where you're repetitively lifting something all day, I hate to tell you again, you're putting a lot of stress on the spine. You might not consider yourself an athlete, but we like to use the term industrial athlete. We are beating our bodies up every day and we're not even realizing it. You know when we do realize it? When it gets too late. When you do have a problem, then it gets, okay, you go to a chiropractor or a therapist or your medical doctor, and that's all good choices. The only thing is already the problem has started. And you might be able to get it taken care of. And we see that all the time. We have people with a lot of problems and they're in a lot of pain, and we usually do a good job with it. But if you don't change your lifestyle and you don't understand that the problem caused because of the alignment was getting shifted and you're moving yourself out of position and you're repetitively stressing this area by either your occupation or your lifestyle, if you don't correct that, you'll be back in my office again or someplace else. And what happens, you see a vicious cycle. People don't understand, and as time goes on, it gets worse and worse. And we want to try to avoid surgery as a last option. Now, let me show you on another model what happens when you let your spine be neglected.